First off, we're looking at the auricular surface of the heart. And we can tell that because first off, we see the presence of the left and right auricle, as well as the conus arteriosus. The auricular surface of the heart would be facing the left side of the thoracic wall. If we turn that heart 180 degrees, we are now looking at the atrial surface of the heart. And we can tell that because first off, we don't see the auricles, and secondly, we can see the presence of the right atrium, as well as the subsinuosal interventricular groove. So that tells us that we're looking at the atrial surface of the heart. Now the heart itself is contained within a sac called the pericardium. If we look at the outermost layer, we see the shiny layer of tissue, which will be the pericardial pleura. Now, if we reflect that, we see a very thick layer, which is going to be the fibrous pericardium. And as we reflect it, we can now see the shiny layer on the inside of the fibrous pericardium. That would be the parietal layer of the serous pericardium. Finally, we can see the shiny layer that's directly adherent to the heart. That would be the visceral layer of the serous pericardium. The cavity that is formed in between the serous or the visceral layer of the serous pericardium and the parietal layer of the serous pericardium, aka where the probe is being located now, is within the pericardial cavity. So we have to reflect that pericardium in order to see all of the structures of the heart. So let's come back to the auricular surface. We see this structure right here is a specific structure that's part of the right ventricle. That's going to be the conus arteriosus, which is the pulmonary outflow tract, and will connect and communicate directly with the pulmonary trunk. Just adjacent to the conus arteriosus, we see a groove that houses an artery and a vein. This groove is the periconal interventricular groove that houses the periconal interventricular branch of the left coronary artery, as well as the great cardiac vein. If we look just ventral to the left auricle, we will see another groove that will actually be encircling the entirety of the heart 360 degrees. That's going to be the coronary groove. Now, if we remove the atria, we can totally visualize all of the structures within the coronary groove. So with this heart, the right and left atrium have been removed, so we're looking down into the coronary groove. Here we see an artery that's wrapping around the right side of the heart, and that would be the right coronary artery. If we look on the opposite side, we will see a very, very short little branch here that leaves directly from the aorta, and that's going to be the left coronary artery. Very quickly after it leaves, it will branch into the periconal interventricular branch within the periconal interventricular groove, and the circumflex branch that will travel within the left side of the coronary groove. Once you get to the atrial surface, that circumflex branch of the left coronary artery will terminate in the subsinuosal interventricular groove as the subsinuosal interventricular branch of the left coronary artery. And here we can see the subsinuosal interventricular branch along with the middle cardiac vein. So the middle cardiac vein travels within the subsinuosal interventricular groove. It moves dorsally and connects with the great cardiac vein that we see here in the coronary groove, and both of them will empty into the coronary sinus inside of the heart. So let's look inside the heart now. So here we're looking at the atrial surface of the heart. We can see the right atrium is in this area, the right ventricle is here, The left ventricle is here, and the left atrium is kind of tucked up underneath this caudal vena cava. If we open the right atrium, we can now look at some of the internal structures. First off, we see this structure right here that is separating the atrium that has been opened up from the ventricle. That is the crista terminalis, or terminal crest. Now as we look into this little pouch or this blind pocket here, we're looking into the auricle, and here we can see these irregular ridges of muscle within the auricle, and those are the pectinate muscles. Now, just adjacent to the crista terminalis, we see another ridge of muscle separating the inflow of the cranial vena cava and the caudal vena cava. This midline structure right here is the intervenous tubercle. And just adjacent to the intervenous tubercle is this depression that's circular in shape, that is the fossa ovalis. The fossa ovalis is the remnant of the foramen ovale from the fetus. So the fossa ovalis is actually present on the interatrial septum. Now as blood moves from the right ventricle into the left ventricle, from the right atrium into the right ventricle, we see the presence of these valves here. Okay, so the valve, this is your right atrioventricular valve or tricuspid valve. It has 3 cusps to it. This cusp here that's present on the septum is the septal cusp. This cusp that's present in the cranial angle is going to be the angular cusp. And this cusp that's present on the free wall that's been opened up is the parietal cusp. So those 3 cusps form the right atrioventricular valve. Now attaching to those cusps are going to be these very thin, delicate strands of tissue known as chordae tendineae or chordae tendineae. The chordae tendineae then attach onto these little nipple-like projections of muscle called papillary muscles. So pectinate muscles are present in the auricle. Papillary muscles are present in the ventricle. Now the blood moves into the right ventricle and will encounter these irregular protrusions of muscle in the ventral surface of the ventricle, and those are the trabeculae carneae. Now, I'm going to close the ventricle, flip the heart to the auricular surface, and now we will see the right ventricle opened up, including the conus arteriosus. The blood will then flow out via the conus arteriosus into the pulmonary trunk. It's at this region that we see 3 semilunar valvules, so 1, 2, 3, that constitute the pulmonary valve. The only thing left to mention is this structure right here, which is a specific structure that spans from the septum, or the interventricular septum, over here to the parietal wall, that is going to carry some of the conduction system of the heart, and that is the trabecula septomarginalis. Now, venous blood will flow out through the pulmonary trunk and enter into the right and left pulmonary vein, or pulmonary arteries, that will then travel to the lungs. The blood will become oxygenated in the lungs and travel back to the heart via the pulmonary artery, or pulmonary veins. So here we can see the blue latexing, which would be present in the pulmonary arteries coming from the right side of the heart. And we see the red latexing here coming from the pulmonary veins. So we're returning from the lungs to the left atrium. Here we have opened up the left atrium. And here you can see the left auricle. And now we can also see the 2 cusps of the left atrioventricular valve. So the left atrioventricular valve, also known as the mitral or bicuspid valve, has a cusp that is present on the septal wall. So that would be the septal cusp, and one that's present on the free wall, which would be the parietal cusp. We see the same structures in here as we did the left ventricle. We see the papillary muscles attaching with the chordae tendineae to the cusp. We also see the trabeculae carneae present here and here. But the one difference that is necessary to understand is that the thickness of the left ventricle is considerably thicker than the thickness of the right ventricle. And that's because the left ventricle has to pump systemic blood to the entire body. Blood will then leave the left ventricle through the aorta, which we see right here. We see the aortic arch with the brachiocephalic trunk and the left subclavian artery leaving it. It's at this area that we will also find the aortic valve that is similar to the pulmonic valve, composed of 3 semilunar valvules.